So what is virtual care? So again, sometimes called telemedicine or telehealth, but essentially it's a way of connecting healthcare providers with their patients and clients through some type of a technology, right? So we're not having to meet in person. And there can be a variety of reasons why this can be helpful. Certainly when we think of access issues, I mean, telehealth and telemedicine have been used for many, many, many years in areas that have been more remote, that simply put, we didn't have providers in certain locations. But as sort of landscape in care and really sort of in our social world has changed over the last year, it has been important to really have more commonplace the availability of virtual care even within the rehab context. So, you know, when we think of some of the key things that really help our patients to be able to make changes and, you know, some of the important influence that, you know, we as rehab providers have with our clients, one of the big pieces actually is around therapeutic alliance. And this is something we're still able to leverage quite well through technology. Arguably, technology that has a video component to it is definitely much easier. You can definitely develop that alliance more easily. You can also engage in other aspects of physical assessment and exam through observing with video that you can't with forms of technology that don't have video. But even with forms of technology that don't have video, there's still a lot that can be done. And I mean, this is actually going to be a mode of healthcare that is here to stay. So now really is the opportunity to understand about this, to really see we can actually accomplish quite a bit, to even when we think of what we just learned about in the last module around health coaching, psychologically informed care, engaging in counseling around lifestyle interventions. These are all pieces that can be delivered the same virtually versus in person. So it's all the more reason to actually hone all those skills. So as I said, you know, we have the removal of traditional barriers with virtual care, right? Now more than ever, it's important, but also importantly, we actually see it works. We have data and many recent publications highlighting that it's actually an effective way of doing care, and doing care specifically in the space of urogynecology, and specifically in the case of physiotherapy and pelvic floor health.